Good morning. Good morning. You're welcome to our today's lecture. We will look at AUF 221, actions and uses of medicines. Remember, we are still on the topic factors. Factors that do what? Factors that do what? Do that effect of what? Drugs. So we started with the physiological factors. So we treated some of them. So the next, how many have we treated? Uh, okay, we enter sex today. Okay. Okay, so factors modifying the dose and what? Effects of what? Drugs. So we look at how sex. When we say sex, we are not talking about the act. We are talking about with respect to gender. Okay, with respect to what? Male or female. I'm trying to see if I'll be able to reply, but this thing is not helping me. Okay, so let's continue. I'll reply offline. All right. So with respect to what's the gender, right? Male or female. Okay. So males and female, they react or they respond to drug what differently in some situation. Am I communicating? Because of the physiological physiologically what is happening in our system may not be exactly what the same thing. Two of us, there are different, a lot of things that differ. So we just see how far we can go. What is the male hormones, female hormones? Male is what? Female what? And what? Persuasion. Okay, good. Now, hello, are we together? Are we together? So, if you are a lady and you have high level of testosterone, you start showing some features of what? Starting from growing beards in some place that is that a lady with beard with shy. She's shy. She's shy. Don't be shy, okay? Huh? Look at me. Look at me. Look at me now. All right, so let's continue. Hello. So basically, generally, testosterone increase what the rate of drug what bio what transformation. Generally, anyway, while estrogen does the opposite. Okay, generally, okay. So estrogen decreases the what the rate of metabolism of drugs like diazepam, and it also does the same thing to acetylcholine. But what happens is that it attacks there's an enzyme called cholinesterase. Cholinesterase that enzyme from the name cholinesterase. It does what? It breaks down what? Acetylcholine. So what it does is that this this estrogen inhibits the action of that what? Cholinesterase. So what it means is that estrogen maintains the level of try to do what? Maintains the or increase the level of what? Acetyl what? Choline by inhibiting the action of what? Choline what? Sterase. Choline esterase is an enzyme. Okay? So what it does is that it breaks. Remember that we were talking about metabolism. Remember, breaks down what acetyl what choline. Okay. So if estrogen inhibit the action of this, so the implication is that this will not have much effect on what this true of us. Remember, so this now will maintain in the what in the system, or the effect will be more in the what system. Have you not seen how this have you not see we are not this is under parasympathetic nervous system and the neurotransmitter. We are not treating neurotransmitters. That's why I'm not going deep. I'm just trying to explain the effects of sex on the effect of this. Am I communicating? That's what I'm trying to explain. Okay, so this I just throw more light on this so you understand how and what happens. Okay, so the effect will was sustained through of us because the estrogen decreases inhibit the action of this. Am I communicating? Let's say I look at the estrogen. Estrogen support the action of this. This will what? True of us. So have you ever seen how sex affect the dose and what effect of what? Am I communicating? Good. So let's continue. So basically, these things are parasympathetic, sympathetic, all those are autonomic nervous system. Remember. So what it means is that females, in summary, in a nutshell, females are more susceptible. That is, they feel the effect of autonomic drugs more. Yes, because of action of estrogen. Am I communicating? The effect of all you can see, they are susceptible to what effect of what autonomic what drugs first. I told you that autonomic nervous system is made up of what sympathetic and what parasympathetic. So this one is more of para what sympathetic. So it's also what autonomic. Am I communicating? So these estrogen females are more susceptible to what autonomic what drug. That is what I'm trying to do. What explain. Are we together? Now, apart from that, you know what prolactin is? What is prolactin? These things are in your material I gave you. So if by now you read through these things, you will not find that the meaning of prolactin, you are wrong. You are what? Very, very wrong. If you see sometimes as you are making your note from your handout, from your lecture materials, you see some words you don't understand, what are you going to do? Use your red pen. Write the meaning by the side of your note. That's how to study. By the time you pick these words one after the other before the end of the semester, the amount of words you'll be able to acquire will be like, when did I learn all these things? As you're making, I can see some of you make notes. That's the wonderful idea. I like it. It prepares you ahead of the class. Now, as you're doing that, you see some words you don't understand. That's why you study with 3 pens. You have your blue pen, you have your black pen, you have your red pen. Each of them have each what? Purpose. Use your red pen right by the side of your notes. Those words that are not familiar to you, you learn, maybe you browse just the meaning. You put it down. As you're studying, it will help you to do what? Remember them. And you use them what? Often. Am I communicating? This is how to study. By now, I didn't you did that. Immediately I mentioned prolactin. You would have told me what prolactin is. So what is prolactin? From the lac. So it's milk related, right? Lac is milk what? So tell me, what is prolactin? One person, please. What is that? What is it? What is it? Is it a hormone? So what does it do? Breast milk what? Expression, right? Formation, right? Which one? Formation, expression, which one? Is it for formation? Are you sure? That I'm not sure. Production. Do you understand what I mean by expression? What is it? Hey! Alright, so now listen. So what does it do? What business do we have with this prolactin? So for a female, listen carefully. A female on anti-ulcers, especially proton pump inhibitors like omeprazole, they have high level of what? Prolactin. Okay? So PPI increase the what? Level of what? Prolactin. Am I communicating? Communicating? Yes. Good. So you see the effect, right? You are treating ulcer and you are on PPI. Then milk production will be what? Will be more. Am I communicating? Is it something in my own? No. Have you seen it now? Have you seen how sex can do what? Why are you laughing? I'm a guy now. I'm a man, so I don't expect to start forming breast milk. Am I communicating? I say I'm not expected. Mark my words. Hello. Please, everything you see on social media are not true. Be careful. But don't be deceived. Hello. Don't be deceived, okay? Those guys are making their money on social media, and they are some of them are even cross-dressing. So then wear some things. There's something I can wear. It will match with my skin color. You see breast. breast, sharp, sharp one. There's some you wear as a lady that will fit your skin color. You see you are obi. So don't be deceived, okay? Yes. They know that they are doing their business. When they are done snapping all this, they go back to the normal life. And they're making money. And you are here. Tomorrow you go and do one nonsense on your body. Let's continue. So are we together? Yes. Are we together? Yes. Good. Even others like some antipsychotics, you still do antipsychotics, antidepressants. We mentioned them yesterday, right? Antidepressant can also lead to what? Lead to what? Increase what? Prolactin what? Level. Now, salicylates. Salicylates. Example of an essay that is salicylate is what? Aspirin, God bless you. Go far. I like that. Okay, you are far already. Good. You are far already. Who now marry Kuskoro? Now, so salicylate and the strong. What are positives? What are they? Examples. That's one we discussed here. Example, what is opposite of if a drug that is a positive? What does it do? What is the opposite of it? What can it be used to treat? Good example. So listen carefully. Salicylate and what positives may lead to what? I'm just introducing you on how to understand pharmacology. Don't cram pharmacology. Hello. The mistake you can make with your life is to cram pharmacology. You don't cram pharmacology. Try to reason it out. Try to know how these things act and what they can do and what they will do. You grab it. If they wake you up, self, you will be able to say one or two things, what you can do in the system without cramming it. How many drugs are you going to cram? How many makers are you going to cram? You don't need to cram anything. Try to understand it first. Am I communicating? Yes. So now, these ones, what do they do? During menstruation, these salicylates and what? Strong positive. They do what? Increase what? Bleeding. So be careful. You are doing what is it called again? If you have pain, you rush and go and take aspirin. Am I communicating? There are other ones you take, 3 or 4. It will bleed, and you don't even know the level of your blood level before you even started. You may bleed and bleed and bleed. I don't know. So avoid. Am I communicating? Have you not seen effects on you because you are what? A female. Are we together? Yes. During your menstrual cycle, during your menstruation, you go and take aspirin and strong positive. What it will do? What increase in what? Bleeding. So you should do what? Avoid them. Am I communicating? So these are small things that small things you will know in your practice. This person knows what he's doing. Oh, I miss so person. Let me go to him or her. He knows what he'll tell you the right thing to do with respect to this drug. You'll be in your house, people will call you from different places, they're asking information about what? Drugs, what they can do, because they have the confidence that you have what it takes to do what? To deliver. So equip yourself. Are we together? Now, generally in pregnancy, next factors we look at we are still under what? Physiological, right? Yeah. Let's look at pregnancy. What happens in pregnancy? That one is, in fact, during pregnancy, a lot of things. In fact, pregnancy is entirely different what? You are entirely different world. A lot of changes will do what? Take place. Physically, psychologically, what are these things we are talking about? Basically, number first, what? There will be an increase of total body water. The body water will increase, even up to what? 8 liters. The body water will do what? Increase. Okay. You be with them, right? Good. Body water will do what? increase. Basically, now if body water is increased, now what do you mean? There will be more space for drugs, for water soluble drugs, and the volume of distribution after absorption in the same situation. That's what you call volume of distribution. You did this in your first year, right? AM 1 to 2. Good. Thank God you're prepared for this. So volume of distribution. Let me not waste my time with explaining this from pharmacokinetic terms. You have done it in your first year. Now, volume of distribution will do what? That what? Volume of what? Distribution. Now, you know what plasma proteins are, right? You know what plasma proteins are? Good. And their effect, their act function as what? Binding site, right? Good. Now, during pregnancy, there will be reduction of the plasma what? Albumin. There will be a what? Reduction of the plasma what? So, does one tell me what the implication will look like? Who will tell me what the implication will look like? When there is reduction in the plasma protein, what do you think? We discussed this in our last class. Hello, please, let's listen to him, please. You go far. So there will be what? More free active drugs in the system. And what if the rate of elimination is not slow? There will be what? Issue. True of us? Accumulation, right? So that means, what is the implication now? Since on a general note, there will be reduction in the work where they will bind more of free drug. That means you check the dose, right? You try to do work on the dose you are doing what? Giving for some drugs. Am I communicating? So when a woman, that's why you have an area of medicine, pharmacy, whatever, that specialize in what? Pregnant what? Women, because they're in their own world. 1 minute, please. So another point I want to make is that during pregnancy there is this increase in what? Cardiac what? Output. Cardiac, you know what cardiac output is? What the heart does what? Pumps out, right? So there's increase in what? It is expected, true of us, provided that the heart is functioning properly. It's expected because there's increase in volume, true of us. So it's expected that cardiac output will what? More under normal, all things being equal in the heart muscles, heart pump. Okay. Now, so there's what? Increase in what? Cardiac what? Output. This leads to what? As it leads to what? More blood getting to where? The kidney, right? So there will be increase in what? Renal blood flow, increase in glomerular what? Filtration what? Rate, all things being equal. There will be what? Increase in what? GFR. GFR means what? Glomerular what? Filtration what? Rates. So basically, on a general note, this will consequently lead to what? Increase in the renal what? Elimination of the what? Drugs. This generally this will do to what? Increase in what? Renal elimination of the what? Drug. Basically, generally. Now because there is because of this condition now, there is increase in renal elimination of blood, sorry, drugs. So that increase in free this thing may not be that issue. True of us, because because their what elimination will do what is increased because of the what the condition of the what the body of the what patient. All right, so now let's continue. What are lipophilic drugs? We did this in your face here. So tell me now, what are lipophilic drugs? Fatty drugs. Hey. Please, watch your language, you. From the name philic from where philia, right? Liking, right? Good. So let's continue. So lipophilic drugs, they cross placental barrier and they are what slowly what excreted. Please note this point. Lipophilic drugs, they cross placental barrier and they are slowly what excreted. So when you are dealing with them, you know how to do what. These things are the decisions the physicians alongside the pharmacist will do what take when doing what the prescribing and the dispensing of the what the medicine. All right, let's continue. Now, is from glomerulus now. Glomerula. Filtration rate. Is it glomerulus or glomerulus? Is it glomerulus or glomerulus? Which one? This one. Are you sure? Confirm. Guesswork. You say guesswork? Okay. Confirm. So if this will give you, this is a noun. Hope you know. This is what? Adjective. Are you aware?
Yes, sir.
So this will tell you from, if you know the spelling of the noun, this tell you what should be here. All right, so you be careful about. In fact, in first trimester, it's even advisable not to take any medicine, except if the physician deem it absolutely necessary, especially when the risk, that's what we call risk benefit ratio. The risk benefit ratio, if you check the ratio of the benefits and the risk, and the benefit is more than the risk, you have no choice than to give. But apart from that, generally you don't try not to take medicine in your first work, because anything that disturbs the uterus can affect the what? Newly implanted fetus. Am I communicating? Anything that disrupts, it may even be uterine stimulants. Normal drugs, that you even take prior to labor to stimulate, to be able to do what? Push baby out. If you take that same drug when the baby is still implanted, have not reached term, baby, you lose baby. Because that movement, that stimulation of the uterus can even flush baby out. I say first trimester. First 3 months, try to avoid. Very important. Unless the doctor looked at you and at this point, if he doesn't do anything, the woman may die. He may have no choice than to give. Let us whatever happens, let it happen. At least let us save the mother. Whatever happens, let it do what happen. He will not say because you don't give during so time. Okay, let me. Hey, you don't give. Hey, the baby will have issue and the mother will die. If the mother dies, the baby dies. Two of us. So it's not left for the physician to now check how necessary to give in that situation. So these things are not easy decisions to take. Okay, so based on that, I want to tell you now here that uterine stimulants, strong positives, and also some drugs that have their inherent issues of having that's what we call teratogenic effects. Teratogenic means what? That they have either that they disfigure or the baby in the womb. That they have maybe some drugs that have teratogenic effect. Maybe if you take that drug during pregnancy, you may end up giving birth to a baby that the hair look like this. Depending on the part of the, at that early stage, different systems of the body are being formed. Am I communicating? Different systems of the body are being formed at different stage. It may be the one that is, it may be formation of here. It will attack the issue and the hand will look like this. Some of these things you see may be some of them may be caused by what the mother took when without even knowing. So I will tell you, you take this mixture. This thing is super. Our great grandmother they were using it. You don't even know what they mixed and gave you. So now, what point am I trying to make here? I'm trying to point out that drugs. I mentioned 3 groups of drugs now: uterine stimulants and the not tetra. The effects. They should be avoided in the what? Especially in the what? First trimester. But that is where most of the formation takes place. So other drugs like morphine, general opioids, basically they have the issue of depressing respiration. That this effect of depressing what respiration in the is the normal side effect or adverse effect. Now, a woman that is pregnant now using morphine, you are putting the baby in the womb at risk of what? Depressing is what? Respiration, and it's a problem because this morphine can cross the placental barrier to go and cause what? Respiration what? Depression in the what? Baby, in the fetus. So be careful about that. So it's also what? Effect. It's not true. So the next one I want us to look at is that one is simple. We have been explaining that plasma protein what? Binding. We have been explaining it from the beginning of this lecture, this topic. So basically, proteins are polymers of what? Wait, right? Okay, now. Of what? Ammonia is all right. Of what? Of what? What is the monomeric unit of protein? Wait, right? Okay, now. You go far. Amino what? Acid. And if you don't eat well, if you are malnourished, there are tendency that you lack in what? Amino what? Acid. And also the tendency of to also affect level of what? Plasma what? Proteins. Am I communicating? So if it's affect level of plasma protein, what is the effect? Is that the binding may not be that what? True of us. So proteins are Polymer protein are polymers of what? Amino acid. So lack of amino acid due to malnutrition or any other cause. Lack of amino acid due to malnutrition or any other what causes can lead to what? Decrease what? Plasma protein. You've been smiling here since. What is it? Tell me. Feel free. What is it? She's been smiling. You know, if you are prepared for a lecture, and lecture is going on, you'll be happy, you'll be smiling. Because what you will say is what? We synchronize with what you have done what? Right. Please prepare before what? Class. It's very important, okay? You'll enjoy the class. You will not even sleep. Yes. There are some here that what I'm saying is like they don't even know what we're talking about because they are not prepared for class. Yes. They have. It's possible that they haven't even opened the. So please prepare for class, okay? All right. So let's continue. So because of lack of what the amino acid, which may be due to what malnutrition, am I communicating? Yes, or any other cause, am I communicating? You may be that you eat well, but in absorption issue, it may not be what the nutrient may not be properly what absorbed. You are as good as someone that did not do what eat out. That's why I said due to what malnutrition or any other what cause basically lead to what decrease what plasma what protein. So this in turn will lead to what decreased binding sites for what drugs. So the binding site will do what decrease and lead to what increase in what free drugs. Two of us, of course, you know the effect. What if it's a drug that has another therapeutic window? Okay, you have a question? Ask.
Sir, why is it when someone eats a good food and the nutrients are not absorbed?
Yes, a lot of things may happen in the system. There are some, maybe it may be at the absorption site. Maybe they have issues, some pathological issues around area that impede what absorption. Am I completing? A lot of things. It's not just one thing. You may eat well, the nutrients. See, I know that it's not the food that you eat is maintained. It's not by eating one food, one hard repeat. There's this saying that you feed your cells, not your stomach. You may feed your stomach, but your cell is hungry. Your cell nutrients is that nutrient in the food, just as you have the active ingredient leaving the drug, leaving the medicine, entering the system. The food you eat is like the medicine, while the nutrients is like the active ingredients. So if you eat food, if nutrients end up not entering the cells, it's rubbish. That's why you see some people, they will eat as no how do they say it? They will eat you not even listen. They will eat, you will not even nothing. They will look malnourished. Something is wrong somewhere. Some may have tapeworms in their system. I bring these nutrients. Am I communicating? Yes. Huh? You say what? Listen, stature is different from looking healthy. I'm not talking about stature. That one is natural, okay? I'm talking about looking healthy. That somebody is slim, someone may be slim, but the person is look healthy. I'm not talking about being big. Hey, being fat is not an evidence of it's not it's even a problem. Hello. So I'm talking about being healthy. You can maintain a slim stature, but you are healthy. You are shining. They look at you. You look at the stain. You are. So eat well, okay? So now, what of body weight? So body weight. Remember, we discussed class rule here, right? I told us that class rules has a lot to do with the body weight, right? Unlike young rule that is dependent on the what, the age, right? So class rule, even BSA using BSA to determine the dose has a lot to do with the weight, even though it's not right because you use the weight to find the BSA first before putting it in the formula. Plus, good. But basically, dose of the drug is very important. Is highly dependent on the weight, the body weight. Is a very thing. Is a very important thing to check. What determine the dose of the drug. Now, so that's why most times you see them giving the dose of some drugs. Some drugs you just see the dose. You just see per body per kilogram body weight. You may see 3 milligram per kilogram body weight. What it means is that for 1 kilogram body weight, the dose to be is 3 milligram. It's not left for you to check the weight of the patient and I know how many milligram the patient needs and do your proportion, true or false, and get your answer. Now, if you have this at the back of our mind, so it's not clear to us that it's very, very important to consider the body weight. If you don't consider the body weight, you may end up giving overdose or underdose, leading to increase in adverse effect or toxicity or therapeutic what. Please let us note that it's very important. So have you now seen how the body weight modify the dose? Because we may be of the same age or you may be older, but the other person's weight is more than your weight. If you see, you feel a person taking more than the dose more than maybe if you have 2 children, one is the weight is something else, the other one is lanky, you can expect them to be given the same dose. If you calculate using the body weight and whatever other BS or whatever, they can never be given the same dose. So have you now seen how the body weight modifies the dose and effect? And because if you give the wrong dose, you will see the effect immediately. Whatever you get it out. You doesn't wait till tomorrow. You start seeing the effect immediately. Either that what you are treating will not go, true or false, or you start developing other toxic signs of toxicity. Am I communicating? Yes. All right, because of overdose. Now, what of lactation? We have talked about lactation here. Some drugs are excreted through the breast milk. That's why if you are asked to discuss pharmacology of any drug, at the end, try to talk about effect of the. If you are asked to, let's say you are asked to discuss pharmacology of ciprofloxacin, for example, now you start from the nomenclature, right? Name of the drug, the name, the brand name. Maybe you can list 1 or 2 brand available, right? Talk about the chemical name. You can write it, talk about it. Then you now go to what class does it belong to? What class does it belong to? Some classes will have subclasses. You mentioned them. Things like people are saying we know is bacteria, right? But under that now we belong to a class fluoroquinolones. I realize now. Then you have to talk about the class. You now go down again to what? Indication, right? What is it used to treat? You talk about making of action. How does it carry out its action? Am I communicating? You talk about you can also mention the dosage forms available. Is it tablet, suspension, at what strength is it available? Then you go down, talk about the side effect, adverse effect. Go down again, talk about the contraindication, situation where you cannot do use it. You go down again, talk about the use in pregnancy. can it be used in what? Pregnancy or not? You talk about use in lactation, in breastfeeding. Can a breastfeeding mother use them? Use such drugs. Now that's why. So I just mentioned this. So it's very to know the importance of it. It's very important because some drugs actually appear in the what? Breast milk. Some drugs appear in the what? Breast milk, and the most time they give undesirable effect on the baby. Yes, on the infants, as case may be. So things like some sedatives, penicillin. Remember when we discussed penicillin? Remember affecting you. Remember that, please. Let's refer to that. Now I ask you, who did that assignment on Gray baby syndrome? Oh yeah, tell us. Father, I'm gonna. Oh yeah, well, I answer no. Tell us about it. Who? Let's hear it. Project your voice. Okay. Okay. Who are giving certain antibiotics? Like chloramphenicol, That's the point I want to hear. It's not. It's the health of the health of these things that are rare. I'm not competing. What makes it? Why that Gray syndrome? I'm not competing. Is there another symptoms there or sign? Okay. Is there any other point that she should not mention? Discussion of where they what? To what? Units, okay. Of course, we know that the out of we have chloramphenicol hydro, two of us, they are there. Good. Now, even ointments. Now, so drugs like purgatives, penicillins, chloramphenicol, oral anticoagulants, they appear in the what? Breast milk. Now, what of food? How does food? Good. In discussing pharmacology of a drug, also include interactions. Yes. There's interaction. We have food drug interaction, and we have drug interaction. Please always put that another one too. There are some, if you ask them, please just give me pharmacology of syphilis. You just mention one drug, they're looking at you, they don't even know where to start. You don't even need to tell long stories. Hit these points, and you get your full mark and go your way. Okay, now, because you know that in this course, both first and second semester, we will meet a lot of drugs. I know why I'm preparing you now. So don't when I ask you, give me pharmacology of a drug, you start writing what I don't know for me. You have to state it well. Make your points. No long story, just hit it. Bam, bam, bam. State it well and hit it. You get your full mark. And then if you are studying any drug, please use that headings to study any drug you are studying. Use the heading I give you now to study any drug you want to study. It will help you to increase your knowledge of what? Drugs. Very important. Then you have to study drugs. Okay. Now, so basically, generally, drugs are better absorbed in what? Empty stomach. All things being equal, if that drug has no issue disturbing the what? Gastric what? Mucosa or causing another issue, all things being equal, it's all things being equal is better absorbed in what? Empty stomach. But because of some issues like gastric irritation, are we together? Basically, it's advised to do what? Take with what? Meal, okay? Take with what? Meals. Maybe after meal or in between what? Meals. But basically, generally, drugs are well absorbed in empty what? Stomach. There are some drugs like that, like some antiamines, okay? Like as in drug used in treatment of what? Worm infestation, right? Worm infestation, right? And like things like um, um, albendazole, mebendazole, the many of them, they are you have to do what? Chew them in an empty what? Stomach. Because there it's infestation. This one there, there are no food, there are nothing distracting, it's facing the worm head on. If it's Ascaris lubricoides, it's facing it head on there in the stomach. Am I communicating? There is no food. You cannot use food to do what? To do what? Form a shield. Three of us, I am making it to we are bringing it down to a local man, a layman understanding. So I'm breaking it down. So nothing with there is acting to them are fighting head on. It's head on. That one attack the worm head on. Ogbodi the worm there head on. Nke abụọ nke eje bịa. Are we together? Yes. So especially this worm, like as there are many worms anyway. But I'm talking about Ascaris what? Lumbricoides. Ask her. Ask her now. Feel free. So some drugs like NSAIDs, some NSAIDs like diclofenac, name them, because of the irritation in the what? Gassy mucosa, it advised to do what? Take with what? Meal. Am I communicating to avoid such what? Effect. In fact, some antibiotic, not that they may cause a bit abdominal discomfort. Like if you take ciprofloxacin in the empty stomach, it may cause some level of what? You may feel like apart from I'm not talking about I'm not talking about on a normal personality ajodogo. You feel some but it will just start a bit and stop. It doesn't go on. So and also of course when food, if there is food in the system and you go and some food may affect what? Drug what? Absorption. Hope you know. That's why you have food drug what? Interaction. Some interaction may be sine what? Sine what? Gistic, right? While some interaction may do what? May be antagonistic. True of us. True of us. So depending. So if it is if the dose that needed for therapeutic purpose is not, you don't need to be too much in the system, and you go and eat with food that will have some interaction that will be what? Synergistic. You know that what will appear in the system will be too high. True of us. Yeah. And it may become what? Toxic. True of us. It will have issues. Now, if the drug interact with the food you eat, and the food will affect the absorption, the one that appear in the system may not be enough for the effect you're looking for. Am I communicating? So these are the things. These are what happens with when you have food in the what. Some of you are taking anti-malaria like artemether lumefantrine. You go and look for juice, orange juice. You use orange juice laden with vitamin C. What is citric acid? What is citric acid? That's the question. What's the difference between citric acid and ascorbic acid? Ask a question. So tell me, okay, ascorbic, ripe fruits. Check it up. Check it up. Okay. On one data. Child. Which point am I making? That vitamin C has a way of affecting artemisinin based drugs. Yes, artemisinin based drugs. So it's not. In fact, if you go to the effect on it is not a good one. Am I communicating? So it's not advisable to use them same vitamin C, even normal vitamin C as a drug with artemisinin based combination. Simultaneously is not good. In fact, keep anything vitamin C by the side. When you are done, you can do what? So now, let alone now when you now start orange juice, or maybe you are taking orange and taking this, you are not helping issues. Am I communicating? So orange, those juice there is food, right? So it can affect the what? The amount that appear in the what? Systemic circulation. So you have subtherapeutic what? That's what some of you take anti-malaria. You know, the commonest anti-malaria available is combination with therapy. You take ACT. At the end of the whole thing, you say that it's not working. It's working. Check what you how you took the drug. Am I communicating? It works. It's effective. All things being equal. Unless there are other things that we don't know about. So you also check the food you eat when taking the what you ate when taking the what the drug. It may also affect it. That's the point I'm making. Are we together? Yes, sir. So what of allergy? What of allergy? What is allergy? Remember, we are talking about, we are still talking about the physiological factors, right? Yeah. Allergy is a physiological issue, right? Yeah. Now, it will affect the dose and what? It will modify the dose and what effect. So now tell me, let's start for what is allergy? If you ask what is allergy, what are you going to say? To what? The immune system reacting, right? Abnormally. The immune system have seen something, if it detects something that is foreign, right? Antigen, right? Drugs, are they foreign? They are xenobiotics, right? So there's possibility of such reaction to take place. Are we together? So drugs are what? Xeno, right? They are xenobiotics. So they enter the system. This antibody, we see them as foreign what? Yes. So the tendency for allergy, that's why you have tendency for allergy is there. Hello, is there. So what's allergy is abnormal response of drug resulting from what? Antigen antibody reaction. Of course, the antibody is of the body, right? Antigen is enters, right? Drugs may be seen as such. If the body can on its own start seeing its own as a threat, let alone something that enters. Sometimes some diseases may be just the body is seeing its own as an issue, as a threat, and start attacking its own. Now, what will it do with something that's coming from outside? You call it auto what? Okay, Maria. Okay. Example of a disease that has such. I mentioned it in this class. Example of a disease that is as a result of what? The body attacking its own. That result from such. Its own itself, Rheumatoid arthritis, rheumatoid. Rheumatoid what? It's a number of such case. Check it up. Check it up. If you check it up. That's why we are here. Check it up. If I tell you, if I tell you anything, check it up. That's how we roll, okay? That's how we do what? We roll. Risk alpha. Have you seen this? What did tell us what it says?
You are referring to autoimmune disease, where the body's immune system is taking attack its own cells, tissues, or organs. Here are some examples. Rheumatoid,
Arthritis. And what's it ever?
things like lupus,
Lupus what? Erythro what?
no,
Okay, lupus. Okay, let me test.
and one diabetes.
That one diabetes, okay?
It's,
Spell it.
it's legal.
Vitiligo. Okay, vitiligo. Tell me one celebrity that suffer from this. God bless you, go far. And that's why he did what? That's why he did what? That's why he did best surgery. There are some people you see, some part of their body will be kanacha yellow. See, that too, a lot of things are involved. It is possible. I don't know. I wouldn't know, but it's possible. You know, the body system reacts somehow. It can react and lead to that. It's possible. It's a possibility. Remember, this is what is an autoimmune what? You should true or false, remember. In diabetes type 1, in type 1 of the diabetes, let me not take it far. So let's round up so that we have here. I was thinking that I will talk by 12:30. I just remember now. Don't mind me. I just look at time and I relax. Hey, let me stop, please. Yeah, I'll stop, please. Hey, no. I will stop. For nothing, when? 3 o'clock. Wow.